proliferative phase during the second half of the follicular phase. Hello, Clinic Review families. Dr. Sharon with Clinic Reviews. Today, I am continuing to work from the Blue Book. The Blue Book is right back there. You can see it. If you're interested in purchasing the Blue Book, you can purchase it on Amazon. Just search for the Blue Book. That's the name of it. And it's published by Mark Klimek. And you can also get it as an app, the Blue Book app. You could probably just Google Blue Book app, or you could go to clinicreviews.com and look for the Blue Book app there. It's a collection of facts that you need to know, just facts. It doesn't have any NCLEX style questions. I write these questions to go along with the book so that you can see how you can take the information in the Blue Book and use it in
42 years old now. For the last 10 years, I've been getting paid $10,000, $15,000, or $25,000 for one keynote talk that, you know what? I'm not that good of a public speaker. I barely graduated high school. I have no post-secondary education. I didn't have great contacts, and to be honest, I hate networking. Always have. But I do have the one thing that speaker bookers are looking for, because of one talk that I did over 13 years ago on the TEDx stage. And because my TEDx talk doesn't just share an idea, it makes a real-life impact. My TEDx talk resulted in funding schools and houses for over 250,000 people. And that was not by accident. It's the strategy that I put into motion when my TEDx talk came out and it got 1,000 views, then 5,000 views, then 10,000 views, and that's when.
Now, by show of screams, who here is at their very first SWE Day?
Taylor Conroy is the guest, and he was a successful Victoria real estate agent, but he gave up that comfortable lifestyle, hoping to make a difference in the lives of people all over the world.
Speaking gigs started rolling in. Hey, can you come and speak at the United Nations, at Harvard, Princeton, Cornell, Disney, KPMG, Morgan Stanley, Pfizer, Lululemon, you name it, all booking me for speaking gigs because I did a TEDx talk. So I thought to myself, wow, if it worked this much for me, I bet it would work for other people too. Like this guy, Kevin, was the first person I ever helped to get on that stage, helped him title his talk, helped him prep for it, helped him land it.
And thank you guys so much. This is a dream come true. Thank you.
That talk got over 4 million views and led to him getting 300 paid speaking gigs all over the world. Or this incredible mother of four, Katie, who started a company called Kitchen Stewardship. She helps parents learn about health and healthy eating and parenting. And I've helped Katie land not one, but 2 TEDx talks that have helped her sell her way more cookbooks, helped her land national PR attention, because this stage, the world's biggest stage, has 38 million subscribers on its YouTube channel. And by the way, I'm not saying this because I'm sponsored or affiliated or even endorsed by TEDx. I'm not. I simply have lived it, and I've seen over 600 of my clients land those stages all over the world, leading to paid speaking gigs, podcasts, and really the authority and credibility that you need to get your message out to all of the people that are meant to hear it. Let me get to the point. I have a list of 20 TEDx events that are looking for speakers like you right now. So I'm going to give you that list when you click the link along with this video. And also I'm going to give you a free training that's going to cover 3 very, very important things. Number 1, I'm going to show you how to stand out on your application so that TEDx organizers see you, pick you out of the crowd and say, I want you on my stage. Number 2, I'm going to show you how to write a talk that spreads like wildfire once it goes online so that you can get that message that you have inside you in front of the people that are meant to hear it. And number 3, I'm going to show you the step-by-step methodology that has helped us land over 600 clients from all over the world so that you can stop playing small and make this the biggest year of your life. So click the link along with this video, and I'll see you on the inside.
If you don't understand the rules of power, you will certainly lose to someone who does. I'm going to teach you how to be more powerful, because power leads to success. Some of the things we're going to talk about having you do are going to make you feel uncomfortable. If you think hard work, loyalty, and waiting your turn will get you promoted, you're dead wrong. If you don't understand corporate politics, people less talented than you will take your promotion. Most people wait for permission, they wait for direction, they wait to be told what to do. Power favors those who move first. Attitudes follow behavior. So if you want to get rid of imposter syndrome, stop acting like an imposter. Don't resent power. Don't resent the people who have power. Master power. I'm Professor Jeffrey Pfeffer, and this is Masterclass.
Hello, Clinic Review family. It's Dr. Sharon with Clinic Reviews. Today we're talking about menstruation and the ovarian cycle. So, do you know when the follicle stimulating hormone is secreted? Do you know when the luteinizing hormone is secreted? Do you know when progesterone is at its highest level? If you don't know that, you might want to watch this video. Stay tuned. Hello, Clinic Review family. It's Dr. Sharon with Clinic Reviews. Today, I am continuing to work from the Blue Book. The Blue Book is right back there. You can see it. If you're interested in purchasing the Blue Book, you can purchase it on Amazon. Just search for the Blue Book. That's the name of it. And it's published by Mark Klimek. And you can also get it as an app, the Blue Book app. You could probably just Google Blue Book app, or you could go to clinicreviews.com and look for the Blue Book app there. It's a collection of facts that you need to know, just facts. It doesn't have any NCLEX style questions. I write these questions to go along with the book so that you can see how you can take the information in the Blue Book and use it in.
Hello.
Do you want to play with me?
Sure. You want me to help you with your groceries? Yeah. This journey with childhood cancer comes at you in waves. Every day we wake up knowing that our 2-year-old has cancer. It's tough to get through.
The tumor is about the size of a baseball. I believe in the power of hope. And from the very first visit here at St. Jude, it was about hope and love, because you go in expecting the worst.
You can join the battle to save lives by supporting St. Jude Children's Research Hospital. Every gift counts, and whatever you can give will make a difference. Make your donation today to help St. Jude save lives.
Just by walking inside the doors of St. Jude, I instantly felt hope for my son.
With a gift right now, you can help save lives. Please become a St. Jude Partner in Hope today. Families never receive a bill from St. Jude for treatment, travel, housing, or food, so they can focus on helping their child live.
For these children to go through what they're going through during this time, and for the supporters to be right there, that means the world. Thank you. It's not enough thank yous.
Join with your credit or debit card for only $19 a month, and we'll send you this St. Jude t-shirt you can proudly wear to show your support.
As a mom, you just want to protect them and be there to watch her grow up, because we don't really know what the future holds. And I think that no family should have to be worried about that.
You can make a difference. Become a Partner in Hope today. Please donate now.
Edema fluid isn't harmless fluid pooling in your legs. It can contain deadly pathogens like this one. Here are the top signs to spot toxic edema fluid. One of my colleagues, a top pathologist, has discovered that the edema fluid pooling in your legs is not just harmless water. It's a buildup of toxins and waste. And as this toxic fluid sits trapped in your legs, it transforms into a bacterial soup, like week-old leftovers rotting in a clogged sink. But he's recently gone public to inform any American struggling with edema that they can conquer it for good using his 7-second edema flush you'll learn about in the next minute. See, the fluid that pools in your legs normally transports bacteria from tissues to your lymph nodes, so it can be cleansed from your body. But as we get older, clogs can occur. This causes the toxic fluid to stay trapped in your legs. It fills them like a stretched water balloon full of infested fluid. Even worse, this stretched skin is extremely prone to cracks. That can lead to deadly infections in the deepest layers of your skin. This is why compression socks and leg elevations can do more harm than good, because they don't actually get rid of the bacterial fluid. They just move the fluid around in your body. And when it comes to water pills and diuretics, they can do more harm than good, because they trigger a hormone in your body that tells your system to hold on to fluid and sodium to compensate for the liquid lost through urine. But Dr. Gyro, a Texas foot specialist out of Houston, recently discovered a 7-second edema flush anyone can do at home that makes legs go from this to this. And no, this has nothing to do with compression stockings, leg elevations, water pills, surgeries, or anything unnatural. It's simple, it's safe, and backed by research from Stanford's prestigious lymphedema clinic, the best of the best. This 7-second edema flush naturally strengthens and unclogs the lymph nodes in your body so it can push, circulate, and flush this stuck fluid out the way nature intended. The best part? This technique helps your body flush out waste more efficiently going forward, which means you don't have to live in fear of the swelling coming back. Since its discovery, Dr. Gyro's helped 54,000 men and women in their 50s, 60s, 70s, and beyond achieve slim, toned legs like they had when they were young, and with it, more confidence, a better love life, and a massive boost to their overall quality of life, even when nothing else worked for them. This is why Dr. Gyro is spreading the word on this as the #1 edema solution that can help even the most hopeless cases. Even better, this edema flush fits into your lifestyle, not the other way around. Think about that for a second. Your life no longer needs to revolve around your swelling. You can go back to wearing your favorite shoes and toss the oversized sandals. No more baggy clothes. You can finally take back control of your freedom and mobility. Just do this simple flush in the morning and live your life free from ugly edema swelling. Want to see how? Dr. Gyro has this video that has gone viral since he uploaded it. I dropped the link for you below.
Questions. So people will say to me, what do I need to know for the NCLEX? Well, part of what you need to know is in the Blue Book. Okay. So, we're part of the greater Clinic Review organization. We do NCLEX reviews on demand. You can get those through clinicreviews.com. You can also do our on-demand tutoring. It comes in, monthly tutoring, small group tutoring comes in a monthly bundle. And then we also have, our streaming service. Okay. So let's go ahead and get started with the questions. What is the average amount of blood loss during a menstrual period? 10 to 20, 30 to 40, 50 to 70, or 100 to 150. So the answer, you just know it or you don't. It's actually, the Blue Book says 50 to 60. I would say it would be right anywhere between 50 to 70 or 50 to 80. I wouldn't go much over 80. I wouldn't go much below 50. That's a pretty good average amount. Which phase of the ovarian cycle begins with the maturation of follicles and ends with ovulation? So what we're going to do today is we're going to be asking the same questions over and over again, but they're going to be worded differently so that you know how to answer these questions. I don't know about you. I'm not an expert on this. So for me to remember what is secreted when and all the different phases can get confusing to me. So I have to practice it. I have to talk about it, talk through it. So that's what we're going to do. So the typical menstrual cycle is 28 days, not the menstrual cycle, but the ovarian cycle is 28 days. Whether your cycle is 30, whether your cycle is 32, whether your cycle is 27, on the NCLEX, you're going to say it's 28 days. Okay. So the first 14, they're divided into two 14-day segments. The first 14 days is called the follicular phase. It starts with menstruation. So that's the shedding of the uterine lining. Starts with menstruation and it ends with ovulation. Then the second 14 days is called the luteal phase that begins with ovulation and it ends at the beginning of menstruation. So the first day of the menstrual period is the first day of the cycle. Okay. So which phase of the ovarian cycle begins with the maturation of follicles and ends with ovulation? That's the follicular phase. We have two phases, the follicular and the luteal phase. All right. How many days after ovulation does menstruation typically occur? So ovulation occurs on day 14. Day 1 is menstruation, the first day of menstruation. Day 14 is ovulation. Then there's 14 more days before menstruation occurs. So how many days after ovulation does menstruation typically occur? It's 14 days.
Are you preparing to take the NCLEX test? Check out UWorld's award-winning test prep. You could spend hours shopping for all kinds of different resources, or get UWorld and have everything you need to ace the NCLEX all in one place. You could study by yourself or have expert educators on your side. You could be confused and stressed, or feel in control as you work through difficult concepts. You could hope for a passing score or track your progress and pass with UWorld. If you're looking to take the NCLEX, visit nursing.uworld.com to get the best prep resources all at one affordable price. Okay, so let me explain my hair growth journey to you. So I have been on the struggle bus with my hair, with my edges, with my chrome, with healthy hair since high school. And that was over 20 years ago. During high school, I thought I was fly, gluing in those tracks, sewing it in, and those edges were just going back, way back. So at work, I have this coworker named Sarah. And so we always talk about hair, and we were like, let's do a little experiment. So Sarah and I, we're both the same age, 46, and the only difference is that Sarah is white and I am obviously black. But we researched, we found these $80 vitamins that boasted that they were gonna do everything we needed, and we were like, we're gonna buy them and we're gonna commit to them. Girl, you know we committed for 9 months. I spent $80 a month for 9 months, only to notice that Sarah's hair, her ponytail was getting thicker, hair getting healthier. She's even complaining about these things while I'm sitting here looking at her and I'm not seeing any growth. I'm actually on my 5th wig, and I noticed that my edges are not growing at all. They were gone. And so I'm trying to figure out what is the difference. We're the same age. I mean, Sarah's white and I'm black, but I thought that the vitamins would work, right? Well, no. So I started doing research because I was like, something's got to be wrong. And here's what I found out. So the first thing is, everybody's always talking about biotin, biotin, biotin. Just take biotin. Well, for me, I couldn't just take biotin. You want to know why? Because I had a relaxer before. And that relaxer actually damaged my follicles. So what I found out was just regular biotin, it would just bounce right off my hair. It wouldn't even penetrate to the damaged follicle. So when I kept researching, I noticed that I needed biotin with silica. And if I get the biotin with silica, that actually opened up the follicles that were damaged by a relaxer, and it helps the biotin to penetrate through. So Sarah didn't need that, but I definitely did. The next thing was, my doctor kept telling me I had a vitamin D deficiency. So I was like, well, it's vitamin D in the vitamins that I'm taking, but absolutely not. I didn't even know that other black women struggle with this. Like 76% of black women have severely vitamin D deficiencies. And so because it's so severe, that's something that we need, because that complete vitamin has like 10 micrograms. So because it's so severe and our melanin blocks vitamin D, it was like I wasn't getting enough in the vitamins that I was taking. I'm looking at Sarah, she's thriving, and I'm over here suffering from all of these deficiencies, and I cannot figure out why until I found these gummies. So these are the Lumen Hair Growth Gummies, and baby, they are the truth. Number one, they were made for us, by us. 2 black dermatologists made this, and they made it specifically for African American women over the age of 45. This had every ingredient that I needed to see the results that I wanted to see. So like that biotin silica complex, it has it right here, penetrating straight through those damaged follicles into the roots. That vitamin D that I needed.
Which hormone is primarily responsible for the stimulation of ovulation? Now, this is where things can get a little bit confusing. So we have the follicular phase. During the follicular phase, we have estrogen levels rising. Estrogen levels, as they go up, stimulate the thickening of the endometrial layer. The endometrial layer is essentially the lining of the uterus, and it gets thicker and thicker because it needs to be thick enough for implantation of the fertilized egg. So estrogen levels go up during the follicular phase, and that endometrial layer gets thicker. The other hormone that goes up is the follicle stimulating hormone. So what happens is we have a follicle, and the follicle matures, and it eventually matures to where it's ready to release an egg. And when it releases that egg, that's called ovulation. So we have follicular development and ovulation, that's day 14. We have, after menstruation is done, we have increasing thickening of the endometrial lining, and that's estrogen that stimulates that. So what hormone is primarily responsible for the stimulation of ovulation? All right, it's none of the ones I just told you, y'all. So I just told you the follicle stimulating hormone matures the follicle. Estrogen increases the thickness of the endometrial lining, but then there's another hormone that stimulates the release of the egg itself, and that's the luteinizing hormone. And that's pretty much the only role of the luteinizing hormone. So luteinizing hormone has like one job, and it stimulates the release of the egg from the follicle. The follicle stimulating hormone matures the follicle so it's ready to secrete the egg. Estrogen thickens the endometrial lining so it's almost ready to take an implanted egg, but it's the luteinizing hormone that stimulates the release of the egg from the follicle, which is ovulation. What is the main hormone during the follicular phase, or what are the main hormones during the follicular phase of the ovarian cycle? So I just told you that, y'all. Do you remember what I told you? And it's not luteinizing hormone. Luteinizing hormone peaks right with ovulation because that's its only job. But it's not really out there any other time. So what are the two? I told you have one that stimulates the maturity of the follicle, and you have one that stimulates the thickening of the endometrial lining, and that's estrogen and FSH. What is the main role of progesterone during the luteal phase? Okay, so we have the follicular phase that ends with ovulation. Once the egg is released, the releasing of the egg stimulates the creation of what's called the corpus luteum. The corpus luteum is a cell layer.
If you're feeling anxious about the future, that is the correct feeling to have. This class isn't about writing prompts.
You know your job better than anyone. When you shift your thinking about AI, you can make 10 times the impact you normally would.
This is how you become an AI-first leader at work.
You're going to walk away from this class with a new way of thinking about AI. You'll start to treat it like a digital companion.
I know it feels right now, you have little control. You have more agency than you realize.
We're going to audit our own job that's broken down your tasks and given you a sense of which ones you should let go and start automating with AI and which ones we should lean into as humans.
Regardless of what happens with AI, you have figured out a way to make yourself indispensable.
I'm Connor Grennan, Chief AI Architect at NYU Stern School of Business.
I'm Nicole Bradford. I've worked in emerging technologies for 20 years.
I'm Amy Webb, CEO of Future Today Strategy Group and a professor of strategic foresight at the New York University Stern School of Business. And this is Masterclass.
I've wanted to do a class with Masterclass my whole life.
Listen up, label owners. I'm about to share with you some disturbing information that can affect the quality and effectiveness of your products. Hi, I'm Oscar Thorvaldsson, CEO of Pure NSM. Pure NSM is the only contract manufacturer offering an ironclad guarantee not to use carrageenan and not to use magnesium stearate behind your back. I've been doing this for over 20 years, and I've come to learn that lots of contract factories do indeed supply their clients HPMC capsules with both those highly processed and arguably dangerous ingredients, and without informing you, the label owner. We at Pure NSM are all about enhancing your standing in the supplement business. If you have any questions, please email sales@purensm.com, and please subscribe and like, because we have lots more to share.
Along the top of the endometrium. So estrogen has promoted the growth of the endometrium. So we've got the endometrial lining that's nice and thick and it's ready for an egg, but then we need something else on top of it. And what it goes along the top of it is the corpus luteum. That occurs as a result of the release of the egg. Once the corpus luteum is in place, it starts to secrete another hormone, and the hormone it secretes maintains the corpus luteum. So the corpus luteum secretes a hormone to maintain itself. All right, what is the main role of progesterone during the luteal phase? It prepares the endometrium for possible implantation. So in other words, it maintains the corpus luteum. Okay, so the endometrial lining is covered by the corpus luteum, and progesterone maintains it. Okay, so that's the main role of progesterone. Which hormone is primarily involved in the thickening of the endometrium? during the proliferative phase of the menstrual cycle. So I told you, and this is why we're using different words so you know how to answer these questions. We have the follicular phase and the luteal phase. The follicular phase starts with menstruation, ends with ovulation. The luteal phase starts with ovulation, ends with menstruation. So what is the proliferative phase? The proliferative phase is another word used for the follicular phase. The follicular phase is the entire phase. The beginning of the follicular phase, you have menstruation. That's where you shed the endometrial lining. Once that is shed, then you begin to proliferate the endometrial lining again. So you shed it, and then it starts to grow again. So this is now the second half of the follicular phase, could also be called the proliferative phase. So what hormone is involved in the thickening of that during the proliferative phase? And I told you what that was, because I told you the FSH matures the follicle, but I said something else thickens the endometrium, and I said it's estrogen. So it's estrogen that's responsible for thickening the endometrium during the proliferative phase, during the second half of the follicular phase. Okay. All right, let's take a look at this. So this shows you what's going on here. So along the top, you can see the follicle. So at the very top, it says ovarian cycle, it says follicular phase. And if you can correspond it with the days below, the follicular phase, days 0 to 14. The luteal phase is 14 to 28. All right. So we have, if you look at this, it says menstrual phase. Well, I'm sorry, let's look at the follicle first. So we have those circles, right? So we have an immature follicle, matures, and by day 14, it releases the egg. Okay, that's the follicular stimulating hormone is causing that to happen. Then we have menstruation. Menstruation they're showing is days 0 to 4. I think it would be more likely to be days 0 to 5 or days 0 to 6. In any event, we have the shedding of the endometrial lining, and then we have it begin to proliferate again. So it starts to thicken again. So you can see in the picture between day 4 and 14, you have the thickening of that endometrial lining. And then you have the ovulation occurs, and you can see that it thickens just a little bit more. It develops that corpus luteum along the top, and it's ready for implantation of the egg. So we have estrogen. You can see estrogen is secreted, and I drew these lines on here, so they're not perfect, but estrogen is secreted right along with the development of that endometrial lining, or the thickening of the endometrial lining. FSH, you can see, is secreted. It goes up to stimulate maturity of the follicle. It goes down a little bit again. I don't know if it goes down that much, but it goes down a little bit again, and then it peaks at the time of ovulation. Then we have the luteinizing hormone. The luteinizing hormone essentially has one job, and it's to stimulate ovulation. So you can see it peaks right at ovulation, and then it goes right back down again. So that's the job of the luteinizing hormone. And then we have progesterone. I think progesterone actually starts to go up a little earlier than I indicated that it did. So I think we could shift it over a little bit to the left. But progesterone is secreted by the corpus luteum, and it maintains that corpus luteum so that it's ready for implantation. The daily iron loss during normal metabolic processes in adults is on average 1.5 milligrams. Okay, so what this is saying is all adults, men and women, use about 1.5 milligrams of iron in daily metabolic processes, like to make more hemoglobin. Okay. So that's the typical. So we need to ingest at least 1.5 milligrams of iron, usable iron, to make up for what we're using every day. All right. How much does this increase per day during menstruation? So because women are losing blood during menstruation, the iron demand is higher in order to make up for the loss of blood. We need more iron to make more red blood cells and more hemoglobin. So how much more? How much more of a demand? Well, you just have to know it. It's 0.5 to 1 milligram a day. So in other words, women should consider taking iron supplements if you're not going to ingest more iron, either during menstruation or even all month would be fine, because our iron demand, our need to make more red blood cells is higher than in men. Which of the following best describes what occurs during the follicular phase of the ovarian cycle? So we're reviewing the same content. We're just asking it in different ways so you can see how to answer different questions.
You have too much information to learn, but too little time. Too much to remember, too many subjects, all your classes, all those lectures. My name is Jim Quick of Quick Learning, and I help people to learn quickly. I've helped students to be able to learn faster and achieve more. I want to be your coach along the process. I'm going to share with you the secrets, 30 days to better success, so you become unforgettable. I share with you how to hack your habits by taking action and joining us now. I'm going to reward you by giving you this program at a huge discount, at a fraction of what others could join for. You have what it takes to succeed. You just need to know exactly what you need to do. That's what this 30-day blueprint is designed to do. I look forward to seeing you on the inside. Thank you, and I wish your day be full of lots of life, lots of love, lots of laughter, and always lots of learning. Take care.
When my team pitched the idea, I thought it was impossible. A pan that sears like stainless, lasts like cast iron, and doesn't use toxic coatings, but it's real. The non-stick is constructed, not coated. It's actually part of the pan. That means it'll never wear off or leach chemicals into your food. Even Michelin star chefs have called it a game changer.
This is the coolest innovation of our lifetime.
We pushed titanium to the limit. We heated it to 1,000 degrees, scratched it, hammered it. And with a lifetime warranty, you'll never need to replace it. That's why we created our Titanium Pro cookware. It's pro-level, toxin-free cooking that you can rely on for every meal, for the rest of your life.
All right, the follicular phase starts with menstruation, ends with ovulation. The endometrium is shed. Well, that's true. The endometrium is shed during the first 4, 5, 6 days of the follicular phase. The corpus luteum forms. Actually, that occurs after ovulation. Follicles mature and estrogen levels rise. Well, that's true. Progesterone dominates. That's actually during the luteal phase. So we're going to cross off B and D. So which is a better description of what happens during the follicular phase? The endometrium is shed, which is only the first few days of the follicular phase, where follicles mature and estrogen levels rise, which occurs pretty much during the entire follicular phase. Well, a better answer, a more broad answer, more of an umbrella answer is actually C. So that's the best answer here. So if you have to choose between something that only covers the first few days of the follicular phase or something that covers the majority of the follicular phase, it would be better to pick something that covers the majority of the follicular phase. Which hormone peaks just before ovulation? I told you that. I said it has one job, not much going on with it otherwise. It has one job. Which one is it? It's the luteinizing hormone, okay? That's what stimulates ovulation. At what point in the cycle is the corpus luteum formed? So we know the endometrial lining is growing as a result of estrogen, and it's nice and thick by the time ovulation occurs. Ovulation occurs, which stimulates the development of the corpus luteum, which secretes progesterone to maintain it and make sure that it's ready for implantation. So at what point is the corpus luteum formed? After ovulation? Yes. During menstruation? No. During the follicular phase? No. During the proliferative phase? No. Remember, the proliferative phase is another word for the growth of the endometrium. Okay, so proliferative is when the endometrium is thickening. That occurs during the follicular phase. So after ovulation is the correct answer. The nurse educates a client on the menstrual cycle. Which hormone stimulates the growth of the Graafian follicle? All right, this, I don't know that I would use this word to teach a patient, but I wanted to teach you the vocabulary word. The Graafian follicle is the official name for the follicle, okay? So remember, I said there's a follicle that's maturing so that it's ready to release the egg. The name of that follicle is the Graafian follicle. So which hormone matures that follicle? Well, we talked a lot about this. You should know it's during remember the follicle phase starts with menstruation, ends with ovulation. It's during this time that the follicle is maturing, and it's maturing in response to FSH. A client asks about the primary event during the luteal phase, what the nurse should respond. Okay, the primary event. Well, let's see what we got here, because I don't really have anything in my head. Follicles mature. No, that occurs in the follicular phase. Progesterone levels rise to support potential implantation. That's true. That happens. Ovulation occurs Actually, ovulation occurs on the last day of the follicular phase, so I wouldn't say it occurs during the luteal phase. The endometrial lining is shed. That occurs early in the follicular phase, so the only one that makes any sense here is progesterone levels rise to support potential implantation. Which phase of the ovarian cycle coincides with the secretory phase of the menstrual cycle? So again, I'm testing vocabulary here for you. So the proliferative phase occurs during the follicular phase. Proliferation means growth, or in growth in number.
I believe that all you really need is UWorld to pass the NCLEX. That's what I used.
There's over 2,000 questions plus self-examinations. However, what you need to know the best is, why did I choose this answer? And read that little rationale.
Compared to other resources, I would say it's definitely the simplest and easiest to navigate. And then the questions, they're so similar to NCLEX style ones, and if anything, they might have been more difficult.
You guys get the UWorld early, start practicing early. It is worth it. They're good. It works. I promise you, first attempt at the NCLEX, passed first attempt.
Contact local agent Dawn Wagner for an auto quote today.
So proliferative phase is when that endometrial lining is thickening. Then you have ovulation. It stimulates the growth of the corpus luteum, and the corpus luteum secretes progesterone. Okay, so another word that can be synonymous with the luteal phase is the secretory phase. Okay, so the secretory phase occurs during the luteal phase because the corpus luteum is secreting progesterone. The nurse is reviewing a client's lab results and notices a peak in luteinizing hormone. This finding is most consistent with menstruation, ovulation, follicular development, or corpus luteum formation. I hope you know the answer to this. This is like the third time I've asked you. Luteinizing hormone has one job, and that's to stimulate ovulation. If the ovum is fertilized during the luteal phase, what hormone will be secreted? So just a couple, this isn't in the, this actually specifically isn't in the ovulation portion of the Blue Book, but I thought I'd cover it here just so you know. So what is a totally different hormone? Not normally secreted unless the egg is fertilized. So what is it that's released when the egg is fertilized? It's the human chorionic gonadotropin, HCG. When should HCG levels be detectable in the blood after conception? Immediately after fertilization, 1 week, 10 to 14 days after the first missed menstrual period. It's 10 to 14 days after conception. Now, this is why they say you should be able to detect like a pregnancy test HCG levels, and it should be positive after you miss your first period, because you have menstruation, right? You have a period. 14 days later, you have ovulation. That pregnancy is going to occur within no more than a week after that. No more than a week. Usually like 5 days. Within 5 days after ovulation, conception will have occurred. So now we still have another 9 days till we would expect another menstruation. So by the time you miss a period, it's already been 10 days at least. So that's why you should be able to detect HCG levels in the blood after a missed period. So this question specifically says how long until it's detectable in the blood, but it's actually the same in the urine. You can detect it in the urine as well in the same period of time. Okay, well, I hope that was helpful. And if you need to watch this video a couple times to get it, that's fine. And you may say, well, I don't talk about this stuff with my patients. Well, that's fine, but I do recommend knowing it for NCLEX. This is the kind of thing that's considered pretty fundamental, just understanding menstruation, like women's health in general. So it is considered pretty important to know for NCLEX. There's a very good chance you could get a question on this on NCLEX, and there's no reason to miss it. You can understand it, I think, if you watch this video enough times. So good luck on your NCLEX. Good luck on all your standardized tests. Thanks for being a part of the Clinic Review family. Good luck.
Being a nurse means being focused on others, on what someone else needs, to get through, to feel better, to get the job done. At Post University, our advanced nursing degree programs are focused on what you need to succeed, with 100% online classes on your schedule and monthly start dates that are ready when you are, so you can go from RN to BSN, BSN to MSN, even MSN to DNP. Ready to move your nursing career forward? Apply now at post.edu.
Okay, guys, we have one more.
It's huge. Give the gift of adventure at Bass Pro Shops and Cabela's. Treasure the magic of the season at Santa's Wonderland with a free photo with Santa. Bass Pro Shops and Cabela's. Your adventure starts here.
Hello, my friends. It's Dr. Sharon with Clinic Reviews. Today I'm doing an overview of labor and delivery. This is as fundamental as you can get about labor and delivery. There is more that we teach about as part of the Clinic Review, which is our on-demand NCLEX review, but this is what you're going to find in the blue book right there that you can get on Amazon or get as part of the app. You can get it as an app through Clinic Reviews. So this is pretty fundamental. You got to know this stuff. So let's go ahead and get started. Hello, Clinic Review family. It's Dr. Sharon with Clinic Reviews. Today I'm doing an overview of labor and delivery. You know this YouTube channel is a part of the greater Clinic Review organization. You can do our NCLEX review, do our streaming service, or do our small group tutoring. It is September. You may be watching this later, but at the beginning of every month, we restart our month of small group tutoring. So you can sign up now for our small group tutoring. And if this is a different month, you can sign up in that month for that month's small group tutoring. We do the same 4 sessions every month. So let's go ahead and get started. You know that I teach the content as we go through the questions most of the time, as opposed to doing a chunk of teaching at the beginning and then going through the questions. All of you, if you're here and you're getting ready to take NCLEX or you're thinking about taking NCLEX, all of you are in a nursing program or you have been in a nursing program. So I don't want to spend a lot of time teaching content that you've already had. This is more, the purpose of this is to remind you of content that you've already had, to make sure that you know content that you need to know to pass NCLEX or your standardized tests that you may have to take to get out of the program that you're in. So let's go ahead and get started. A pregnant client in her 3rd trimester reports feeling that it is easier to breathe, but she has to urinate more frequently. The nurse suspects that the fetus has dropped and that, sorry for the typo, and that lightning has occurred. Okay, so let me read that again. The nurse suspects that the uterus has dropped and that lightning has occurred. How long before labor begins does lightning usually occur? So this is just a vocabulary word. Do you know what lightning is? Lightning is when the baby drops lower in the abdomen. It pushes more on the bladder and the baby is getting ready for delivery by dropping down lower. So when does that usually happen? So either you know it or you don't know it. It's 2 to 3 weeks before delivery is when the lightning usually occurs. And it's okay for us to tell the patient that. Sounds like lightning has occurred and you're probably about 2 to 3 weeks out from delivering your baby. A client at 39 weeks of gestation comes to the obstetrician's office and is found to be fully effaced and 3 centimeters dilated. Which of the following signs most strongly suggests that the client is in true labor? So we say, well, they're fully effaced and they're 3 centimeters dilated. Are they in labor? Because she may say, well, am I in labor then? I mean, these are signs that she could be going into labor, right? So when do we say, yeah, we really do think you're in labor? Contractions decrease in intensity when walking, regular contractions, fetal movement increases, or Braxton Hicks contractions. So I know Braxton Hicks contractions is false labor. Fetal movement doesn't increase, that's no indication of labor. Fetal movement might increase, but that doesn't have anything to do with she's gone into labor, okay? So that has nothing to do with it. So would I expect contractions to decrease in intensity when walking, or would I expect her to be having regular contractions? So if she says to me, I'm having regular contractions, I'm going to say, looks like you've probably gone into labor. So regular contractions is the best indicator that they have actually gone into labor. If they have contractions that increase in intensity when walking, they may have gone into labor. Okay. So, but in this case, regular contractions is the best indicator that somebody has gone into labor. If she came in fully effaced and 3 centimeters dilated, but she was not having contractions, don't tell her she's gone into labor. Say, I bet you're going to go into labor really soon. Because if you're fully effaced, effacement is the thinning of the cervix, and dilation is the opening of it. But I wouldn't tell her she's gone into labor. You just go, you're really getting close there. You're going to be going into labor here really soon. And effacement usually occurs before dilation, just so you know. So it's not unusual to be effaced before you're dilated. A nurse is assessing a laboring client's cervix and notes that it is 50% effaced. What does this indicate? The cervix has shortened by half. The cervix is fully dilated. The baby's head is crowning. The cervix is dilated. So dilation and effacement are not the same thing. So I can cross out B and D. And effacement doesn't have anything to do with where the baby's head is at. So the only answer that makes any sense is the cervix has shortened by half. And I did put a picture here. I wanted to show you this because you may think, what? It's shortened. So here on the left, the cervix is not effaced or dilated. Okay, so you can see where the cervix is. And then the second picture, the cervix is 50% effaced and not dilated. So you can see that it's actually shortened. So when the cervix is 100% effaced and dilated 3 centimeters, you can see it starts to open more. So effacement is that shortening of it. But just so you know, the cervix is way thinner than that. When it's fully effaced, it's paper thin. So they can't really draw it paper thin or you won't be able to see it, but it's paper thin when it's fully effaced. And then you can see there on the right, the cervix is fully dilated to 10 centimeters. Which of the following best describes what occurs during the 3rd stage of labor? So we have 4 stages. Okay, 4 stages. The first stage is labor. The first stage is labor. And during labor, we have 3 phases. So we have 4 stages. The first stage is labor. The second stage is delivery of the baby. The third stage is delivery of the placenta. And the fourth stage is recovery. So which of the following best describes what occurs during the 3rd stage? Well, which one is it? The cervix dilates. The fetus is delivered, the cervix effaces, the placenta is delivered. What is the 3rd stage? It's delivery of the placenta. The second stage is delivery of the baby. The first stage is labor. And then we have the 3 phases of labor. So stages are the big ones. Phases are the smaller pieces of labor. During a vaginal examination, the nurse notes that the client's cervix is dilated to 7 centimeters. Which stage of labor is this client in?
Attention retirees, if you're willing to be at your computer from 9 a.m. to 10:45 a.m. on most weekdays, I can show you one simple trade that could potentially bankroll your retirement. Hi, I'm Dave Aquino, and I help ordinary people go after their retirement goals sooner by teaching them how to master the retirement trade. This is a special trade designed to be used every morning between 9 a.m. and 10:45 a.m. Eastern Time. Why this window? I can't share that information in this video, but you'll discover the exact reason why inside this free report. Just click the button or link on this video to download this valuable report for free. Click the link now. This video is ending in 5 seconds, so click now.
Dance is more than just using your body. So much of dance is in your expressions.
Squinting has likely contributed to my crow's feet.
My friends say I make this look a lot.
I was treated for my moderate to severe frown lines.
Crow's feet.
And forehead lines.
Botox Cosmetic
has been FDA approved for over 20 years.
Talk to your doctor about Botox Cosmetic and whether it's right for you. The effects of Botox Cosmetic may spread hours to weeks after injection, causing serious symptoms. Learn more at BotoxCosmetic.com.
The first stage, latent phase, first stage, active phase, second stage, or third stage. Well, second stage is delivery of the baby, and she's still laboring, so that can't be it. The third stage is delivery of the placenta. She's still laboring, so that can't be it. So is she in the latent phase or the active phase? She's in the active phase. So 1 to 4 centimeters is latent. And it's called latent because there's a lot of time between contractions. So many women anymore are induced that a lot of women never really experience the latent phase. But if someone goes into labor naturally, the latent phase can last quite a while, can last hours. This is if a woman is doing a natural delivery or if she's delivering at home. This is the latent phase is when she's still walking around, probably still taking care of her kids. She's like, yeah, I'm definitely having regular contractions. They're happening every 10 minutes, maybe every 7 minutes. Honey, you can come home from work. I'm not going to be able to take care of the other kids for very long. Maybe she wakes her spouse up in the middle of the night, says, I'm having regular contractions, but it's not going to happen for a while. So this is the latent phase. And she's between 1 and 4 centimeters. And then 5 to 7 centimeters is active. So she's actively laboring. Her contractions are occurring every 3 to 5 minutes. And she's working hard. She's in a lot of pain. Once she hits 8 to 10 centimeters, that is the transition phase. She's transitioning from laboring to delivering the baby. So she's still in the first stage of labor, which is laboring, but she's transitioning. She's getting ready to move into that second stage of labor, which is delivery of the babies. But this at 7 centimeters, she's still in the active phase. How much blood is typically lost during a normal vaginal delivery? It's not measurable, 10 to 200, 100 to 200 mils, 300 to 500, or 800 to 1,000. So it's 300 to 500. So friends, you're not bleeding out. They're not hemorrhaging out when they deliver. This is all blood that's been part of the placenta and that's been part of the uterine wall, that's been providing blood and oxygen and nutrients to the baby, and that it's not needed anymore. So it's gotten rid of. Okay, so she's not hemorrhaging out. She's sloughing off the inner lining of the uterus, and she doesn't. You get the entire placenta. The entire placenta needs to be delivered, or they're going to be at risk for hemorrhage or infection. But there's still some lining left in there that will over time slough off, right? It takes several weeks, a lot of times for that to slough off. So she'll be having normal vaginal drainage for several weeks after delivery. During the latent phase of labor, what is the expected cervical dilation? 0 to 3 centimeters, 4 to 7 centimeters, 8 to 10 centimeters, 10 to 12 centimeters. Latent is that early phase where you're not feeling too much. So I said it was 1 to 4. Either way, you know it's not 4 to 7, right? Because 5, 6, 7 is definitely active. So you might go, well, Sharon, you told me the wrong number. Okay, use your common sense here. We know it's not any of the others. It has to be A. That's the only one that makes any sense because latent is the very earliest stage of labor and delivery. Which of the following occurs during the second stage of labor? It's not the phase, it's the second stage. So the first stage is labor. The second stage is delivery of the baby. Third is delivery of the placenta. And then the fourth is recovery. And so here we're in the second stage. So it has to be delivery of the baby or delivery of the fetus. During the transition phase of labor, so we're in the last phase of labor before we move into delivery of the baby. Okay, so now she's really working hard. She's in a lot of pain. She's probably saying, I'm never going to do this again. The client becomes very irritable. Yes, of course, and reports strong, frequent contractions. Yes, of course. What is the expected cervical dilation during this phase? 0 to 3, 4 to 7, 8 to 10, or fully dilated. Y'all, when they get fully dilated, once they hit fully dilated, it's time to push. Do not have them push before they are fully dilated. Okay, so they can push once they're fully dilated, and now they've transitioned into the second stage of labor and delivery, which is delivery of the baby. So in the transition phase of labor, they're still laboring. So that's 8 to 10 centimeters. Of the 4 women who are in labor, which of the following is most likely to deliver the baby first? A client who is actively laboring and is screaming and crying in pain. A client who is 9 centimeters dilated and says she feels like she needs to push. A multigravida who is 6 centimeters dilated and fully effaced. A client who is in the transitional phase of labor and states she feels like she needs to have a bowel movement. So I wanted to teach you that when they're in the transitional stage, and if they tell you they need to have a bowel movement, y'all, you pay attention. That's the baby's head pressing on the rectum. And very likely you take a peek there, you're going to see hair or the scalp or whatever that baby's coming. So pay attention, okay? So if she's like in the latent phase and she says she has to have a bowel movement, maybe she needs to have a bowel movement. But if she's in the transitional phase and says, I feel like I have to have a bowel movement, you better expect that baby's coming. So what about the others? The others actively laboring, she's still in the second phase. She's going to have the baby, but just because she's in a lot of pain doesn't mean she's about to deliver. Someone who's 9 centimeters dilated, don't let them push until they're fully dilated. Okay, so she's probably going to have it soon, but she's not ready to push yet. Say, no, you can't push yet. A multigravida. Okay, so we go, but she's a multigravida. She can have the baby any minute. Well, she could, but we don't have evidence yet that she's about to deliver. We only know she's 6 centimeters and fully effaced. So yeah, she's actively laboring, but we don't have any evidence she's about to deliver. D is the person we have evidence she's about to deliver when she is in the transitional phase and she feels like she has to have a bowel movement. Leopold's maneuvers are used by the nurse to determine what during a labor assessment: the position and presentation of the fetus, the length of the cervix, the stage of labor, the frequency of contractions, just so that you know what a Leopold's maneuver is. It determines the position and presentation of the fetus. So the nurse, this is not something I can do, y'all. I'm not a labor and delivery nurse, but they can palpate the fetus and they determine where the head is and where the buttocks are and where the feet are. And they say, okay, they're in this position and this is, they're in the right position for delivery or they're not in the right position for delivery. Which of the following is the most important indicator of fetal well-being during labor? Fetal well-being during labor. Remember, you have 2 patients. You have mom and baby. You have to check on both of them. If they tell you something's going on with mom and they say, what should you do? Okay, what should you do? Usually you're going to say, let's see what's going on with baby before I decide what to do for mom. Usually, because I don't know what to do for mom until I know what's going on with baby first, right? This is what I'm talking about during labor and delivery. Okay, I'm not talking about recovery. But while we're still monitoring baby, like check and see what's going on with baby, okay, before you decide what to do. So what tells us how the baby's doing? So if I want to check on the baby, how do I do that? Well, I can't physically assess the baby. There's only one way I know how baby is doing, and that's looking at fetal heart rate and variability. So pay attention. That's a very good NCLEX answer. Checking fetal heart rate and variability is a really great NCLEX answer because that tells you how baby is doing. The provider performs an amniotomy to induce labor. Which of the following should the nurse monitor immediately after the procedure? So an amniotomy is where they break the obstetrician breaks the water. Okay, so there's on top of the baby's head is the amniotic sac can be broken and you can lose all the amniotic fluid, which can you imagine being the baby and like you're in a warm bath and then all of a sudden, what? It's all draining out. What's going on? I mean, you cannot possibly be happy about that. So anyway, an amniotomy is where they break the water intentionally. So what should you do next? What's the most important? Let's see, what does it say? What should the nurse monitor immediately? It doesn't say most important. It's really a first question. So what should they monitor first? You just broke the water. Maternal blood pressure, cervical dilation, contraction, intensity, or fetal heart rate. So y'all, I just told you that you do something to mom, you got to see how that affects baby. We just broke the water. We've got to see how that affected baby. So let's take a look at that. We can do the other things later.
What is it about Chamberlain University that makes our nursing students so successful? The opportunity to learn from anywhere with support that comes from everywhere. And the promise that no matter where you're from, we'll get you where you want to go. With professors that guide you forward and a community that has your back. Our culture of care and support gives every student peace of mind in knowing you've got this and we've got you. That's what you can expect from the #1 largest nursing school in the country, Chamberlain University. Belong to something greater.
Color after color. Hair feels more damaged? Discover Olea. The power of 60% oils, no ammonia, propels color deep into the hair while protecting its surface. For visibly improved hair quality and maximum color impact. Color after color. Olea by Garnier, naturally.
Next, after we check fetal heart rate, okay? The nurse is caring for a client in labor when she notes that the umbilical cord has prolapsed. What is the priority action? All right, so this is one of the exceptions to what I just talked with you about. Prolapsed cord is when the umbilical cord falls out of the birth canal before the head of the baby. So it comes out before the head of the baby. What is the risk with prolapsed cord, prolapsed umbilical cord? The risk is the baby's head is going to press on it. And you should assume, if they tell you there's prolapsed cord, you should assume baby's head is resting on it. You should assume that. Now, what's the risk with prolapsed cord? The risk is baby's head is going to rest on the cord and it's going to compress that cord. How is baby getting oxygen? Baby's getting oxygen through the cord. Okay, so we have got to get baby's head off the cord. How can we do that? Well, the more extreme way to do that is to physically, with 2 fingers, lift the baby's head off the cord. But that's not usually the answer I see on NCLEX questions. What I usually see is repositioning, and repositioning involves through gravity getting mom's hips up so that baby's head falls back off the cord. So that's usually what I see. So, all right, so I haven't even read the answers yet. I'm just telling you what I'm thinking as I'm reading this question. So she's in labor, she's got a prolapsed cord, and I think, uh-oh, baby's head is on the cord. So what is the priority? If I can only do one thing, what one thing do I have to do? Continue to monitor fetal heart rate. Well, I definitely want to do that. I just told you that's really important. So I definitely want to monitor fetal heart rate. Reposition the client to relieve pressure on the cord. Well, I definitely want to do that. Increase the IV fluid. I want to do that. Prepare the client for immediate delivery. Not necessarily. That's not necessarily true. It may have to happen, but if I can get baby's head off the cord, we may not have to do that. So I'm going to say, I'm going to have D be off. I'm crossing off D, and C, I want to do that, but I don't have to. If I can only do one thing, that's not the one thing I want to do. Okay. So I'm going to cross off C and D. So my concern is that baby's head is resting on the cord. So do I want to continue to monitor heart rate, but not reposition the client to relieve pressure on the cord? Or do I want to relieve pressure on the cord, but not continue to monitor fetal heart rate? Y'all, if I can only do, look, that's the problem with priority questions is there's usually 2 and you want to do them both. And what they want to know is, do you know what you have to do? Y'all, you have to get the baby's head off the cord. You have to. Do not say, well, I'm going to monitor because Dr. Sharon said monitoring fetal heart rate is a good answer. Okay, but when baby's head is pressing on the cord, you got to get the baby's head off the cord. Okay? Okay. After delivery, the nurse notes that the client's uterus is boggy, which means it's soft. So normally the uterus after delivery contracts and hardens. You should have a firm uterus after delivery. So after delivery, the nurse notes that the uterus is boggy and not contracting well. What condition does this suggest, and what is the primary risk? Uterine atony, and the risk is hemorrhage. Uterine inversion, and the risk is infection. Uterine prolapse, and the risk is pain. Or uterine rupture, and the risk is preeclampsia. So there's only one here that makes any sense at all, and that's uterine atony is the word used when the uterus is not contracting. That is what that word means. And the risk is hemorrhage. And I'll be honest with you, I'm not completely sure why the risk is hemorrhage, but I think there's something, because there's all these of mom's blood vessels that are going to the uterus, right? That's how baby's getting blood, right? Because it goes through the placenta and through the umbilical cord. And so all this blood is going there. And I think what happens when the uterus contracts is I think it compresses all those blood vessels so they cannot hemorrhage. So I think what happens is that when it doesn't contract, those blood vessels stay sort of viable and open, and the risk is hemorrhage. That's a best guess. I didn't look that up, but I think that is probably right. Okay, so that, y'all, this is just a fundamentals of labor and delivery. This is not all you need to know for maternity. It's just a fundamentals of labor and delivery. It's an overview of labor and delivery. But if I had to say, if I could only know a few things, like I'm not a labor and delivery nurse, so I only know a few things, what I just talked with you about right now, you got to know it for NCLEX, y'all. You got to know it for your standardized tests. Okay. All right. Good luck on everything, your tests and everything. Thank you for watching to the end of the video. I do appreciate it. Thank you for being a part of our Clinic Review family, and I'll see you later. Hello, Clinic Review family. It's Dr. Sharon with Clinic Reviews. Today we're talking about acne, and there are some common medications that are used to treat acne that we're going to talk about today. I had someone say to me just yesterday, who failed NCLEX. They failed twice. The second time they failed at maximum questions. And by the way, if you fail at maximum questions, you're this close to passing, y'all, this close to passing. But she said to me, there were so many meds on there that I didn't know. So we're going to talk about meds today, and we're going to talk a little bit about how you can answer questions when you get a med that you don't know how to answer. So let's get started with that. Hello, my friends. It's Dr. Sharon with Clinic Reviews, the very best NCLEX review in the entire universe, in my opinion. You can go to Climic, K-L-I-M-E-K, climicreviews.com to sign up for our on-demand NCLEX review. You can also get our small group tutoring, and you can also sign up for our, what is it called? Streaming service, where all of our videos, not the NCLEX review videos, but all of our other videos, including those on here on YouTube, are available ad-free, and it's a $19.99 monthly fee. So if you're in a rush, you're like, I got to get through all these videos, but I don't want to watch all these ads, and I don't want to fast forward through all these ads, you can go to climicreviews.com and sign up for the streaming service for just under $20, and you can get all of our videos ad-free. Today we're talking about acne. Let's go ahead and get started. This is from the Blue Book. Remember, the Blue Book you can get on Amazon. You can purchase it as an app through climicreviews.com. And this is a book of facts, and I write questions to go along with these facts to show you how you can take this information and use it. But it's going to take me a lot of videos to get through the entire Blue Book. So if you're getting ready to take your NCLEX soon, you may want to purchase that book. So I teach about the information by doing questions. When I go through the Blue Book, I don't teach about the content ahead of time. I just teach as I'm going through the questions, okay? A 16-year-old patient presents with moderate acne. Which of the following is the most common causative agent of acne? Y'all, this is just a fact question. There's no clinical reasoning going on here. I'm just testing whether you know the answer. And I hope that if you're guessing, I hope you would pick the one that has the word A-C-N-E in it. Okay, it's P acne. I don't know how it's pronounced, honestly. And I'm not going to try to pronounce the P word. It's a bacteria. Okay, so it's a bacteria that actually causes acne. And that's what you should remember. A nurse is providing education to a patient prescribed topical benzoyl peroxide for acne. Which of the following should be included in the teaching? So the common medications that are prescribed for acne are vitamin A, this one, benzoyl peroxide, and Accutane. Okay, retinoids. Retinoids, an example is Accutane. So this is a topical one. Accutane is an oral medication, but this is a topical one. And what do we need to teach someone about this medication when they use it? You should apply the medication immediately after washing your face with hot water. This medication may cause your skin to peel, which is normal. Apply the medication only to the affected areas twice a day. Expect to see results within 2 to 3 days. So I know that you're not going to expect to see results within 2 to 3 days. It takes 4 to 6 weeks to start to see results from most of the different types of acne treatment. So I'm going to cross off D because I know that's not right. C, apply the medication only to the affected areas twice a day. Now, if I'm not reading this carefully, I'm going to like this answer because I like the idea of applying this twice a day. Now, I do know that we recommend people start slowly with this. So we recommend doing it just once a day, and then you can take it up to twice a day if your skin can tolerate it. But I do like C. Here's the reason I'm going to cross it off. Is because it has the word only in it. I've told you this before, but only is an extreme word. And an extreme word, I know it's an extreme word if I take it out, and I like the answer better. Apply the medication to the affected areas twice a day. That's fine. I like that. But only to the affected areas, y'all, they put it over their entire face. They don't only apply it to the affected areas. So because it has an extreme word in it, and I know that NCLEX often uses extreme words to turn right answers wrong, I'm going to cross off C. This medication may cause your skin to peel, which is normal. That sounds right to me. So if you're putting on a medication that's going to be pretty hard on the skin, it's going to be killing any of the bacteria, that P. acne that's there. It's killing that. It's probably doing some other things. I bet it's going to make the skin peel. Like, that sounds really reasonable to me. So I'm keeping that on there. you should apply the medication immediately after washing your face with hot water. So if I'm guessing, there's two extreme words in this statement: immediately and hot. I don't like hot.